starts, I just want to say thank you. You know, as we've gone through issues from, and continue to go through issues from opioid addiction to gun violence to now this, Jeff and his team have been an integral partner to us at the City of Dayton, and his leadership is trusted, I know, by us and by the whole community. So we really appreciate all you're doing and all your team is doing. Good morning.
Good morning, and thank you on behalf of Public Health Dayton and Montgomery County Commissioners and Mayor. We really appreciate the opportunity to be here today to share our information. We recognize that this is a rapidly evolving situation. I think the key message is we as a community should not be overreacting, but we should be implementing best practice based on the evidence base of public health and use that in our decision making. With me here today, we have our medical director, Dr. Michael Doan. So between the two of us, after we present the information, we will be able to answer questions, general questions, as well as more medical-related questions. So we'll
click it on.
We'll go through this. Oh, there. That's the wrong one.
There's other reasons I'm here.
Yeah, there's another reason why Mickey's here. He's more skilled at this than me. There we go.
You know, sometimes the technology.
There we go. So please know that Public Health Dayton and Montgomery County is on a daily basis reviewing all of the relevant information. So we're staying abreast of the World Health Organization information, CDC, as well as the Ohio Department of Health, and we are working within our 8-county West Central Ohio region to make sure that all of our planning and response is consistent among health departments, public safety forces, as well as our healthcare partners. So we all understand that on December 31st, 2019, for the first time, China reported a novel or new coronavirus. And we didn't put a slide together showing the chronology from December 31st through now. It's just within that time period, now you see the chart of where this is internationally. So it continues to become a global spread. It's currently designated as an epidemic. Very likely in the coming days, it will be officially declared by the World Health Organization as a pandemic, indicating spread throughout essentially most countries. I will apologize in advance, but these numbers are probably already outdated, and we compiled them yesterday. So if you look at the United States, that was as of yesterday, 647 cases, obviously more than that now, 25 total deaths within approximately 36 states. We will continue to update this information, and it will be displayed on our website on a daily basis. Key message, though, however, is how likely is it for someone to contract the virus? Most people in the United States still continue to have low risk of exposure, and that's really important. That doesn't mean that we dismiss this. We give full effort to addressing it, but most individuals have low risk of exposure. Obviously, there are some exceptions in terms of who's most at risk. So if you are a close contact, essentially think of that as a household contact of someone who may have the virus and be infected, you are at greater risk. If you're a healthcare worker treating someone who is ill, or if you are fire EMS personnel potentially transporting someone, close contact, you are at greater risk, but there are precautions that can be taken. And then, unfortunately, older adults used to have a different understanding than what it is right now. And so now it's essentially age 60 or over. In my mind, that doesn't seem elderly or old, but it's a new reality for all of us. So, older adults, individuals with a weakened immune system, individuals with underlying medical issues such as cardiovascular disease, respiratory diseases, diabetes, etc., as well as travelers returning from infected areas. Those are individuals most at risk. So the symptoms, we've all seen this. Fever, cough, shortness of breath. The incubation period for this virus is estimated to be 2 to 14 days. A more likely range may be 5 to 7 days. Time from exposure until development of symptoms. Boy, the public health message, though, in terms of prevention, is the same message for seasonal flu. Wash your hands, cover your cough, don't touch your face, avoid sick individuals. Those are common prevention messages. They work for seasonal flu, they will also work for COVID-19. And so how is it spread? I think this is really important that we all understand close contact. And by close contact, the historical definition in the public health arena is within 6 feet. Okay? So I'm not having close contact right now with the commissioners and the mayor. Also, the virus is known to spread by droplet spread as opposed to airborne. Airborne, you sneeze or cough, those virus particles are suspended in the air and they remain suspended in the air. And then as other individuals walk into the room, there's potential for exposure. That's not the route of exposure for COVID-19. It's respiratory secretions and droplet spread. So I have symptoms, I cough or sneeze directly onto someone or onto a surface and then someone touches that. That's droplet spread. Think about it. When you sneeze or cough, you're in a room. That doesn't remain airborne because then every time everybody else would walk into that room, they'd go, ooh, what did I just walk into? Those droplets settle out pretty quickly. They settle out on surfaces. So COVID-19, not airborne spread, close contact, respiratory droplets. Well, what if you are someone who actually contracts the virus and is sick? The message is pretty simple. Stay at home. Avoid contact with other individuals. Obviously, cover your cough, cover your mouth when sneezing. Environmental surface cleaning is very important. Wipe down surfaces on a daily basis. And then that brings us to the last image on this slide, an individual or a picture of someone wearing a mask. So if you're a sick individual, a mask may be helpful in terms of assuring that you're not spreading respiratory droplets to others. But as far as the general public who are not ill, are not experiencing symptoms, there's no need to wear a mask. And in the recent days, we've been informed that testing kits are now available, and there will be more and more becoming available throughout this state and this country. Two options. The Ohio Department of Health has set criteria for specimens that they will accept to test, and they're going to be testing those individuals who are most at risk and most vulnerable, and then 2 private laboratories to date are going to be offering testing. I think that's Quest and LabCorp are the 2. The key is you need to talk to your physician if you believe you need to be tested and let that clinician make the determination of whether or not testing is necessary. So how has public health been responding to this global crisis within our community? And I'd like to set the context here. Public Health Dayton and Montgomery County over the last 20 years has been using a structure that we adopt and implement to respond to whether it's a terrorism incident, a natural disaster, or an emerging infectious disease such as COVID-19. So really, since the 2001 World Trade Center tower attacks, and then the subsequent anthrax attacks in this community that same year, we have been using a response structure to respond to any type of emergency. So whether it's the 2009 influenza pandemic, or the hepatitis A outbreak, or several years ago, the Ebola issue, or the Memorial Day tornado response, the mass shooter response, the opioid crisis, infant mortality, or building a food system, we apply the structure that you see on the screen in front of you. And please understand that all of our response partners are using this same type of response structure. So our hospital systems are well-versed in this. Public safety forces are well-versed in this structure. And we are actively communicating with all of those entities in our response to COVID-19. As a community, as a region, and as a state, we have been planning, training, and exercising together for essentially 2 decades to be able to manage this emergency in our community to assure that we protect the health of our citizens. Everyone in Montgomery County and in the city of Dayton should have confidence in our community's ability to manage this issue. That's not saying it's easy, but we will manage this issue. So which brings us to, what can we all do? What can jurisdictions do? Well, first of all, keeping citizens informed and making sure that our citizens develop a family emergency plan. And it's the same message in terms of developing a family emergency plan that we would give whether it's seasonal flu or inclement weather or anything like that. So, and we have a checklist that's on our website, and we'll make sure the city has it as well, that you can distribute to your citizens. Like all organizations and all jurisdictions should be looking at their continuity of operations plans. In the event that this spread increases and it affects more people, we need to make sure that we continue to provide mission essential programs and services, and that we have adequate staffing to be able to do so. Review all of your policies and procedures and consider virtual meetings. We're all staying abreast of what's happening in the media, and most large events and most individual or meetings that are bringing people together are going to Skype or some other form of teleconferencing. We'll make sure that that Public Health Dayton and Montgomery County gets you all the up-to-date information. You can either put that on your own website or link to our website. We would ask all jurisdictions to consult with us regarding upcoming mass gatherings and planned events so that we can provide the most up-to-date public health guidance based on the evidence base that's been being developed nationally. And then in the event that this continues to escalate, that we would, as the county and the various jurisdictions begin to activate their emergency operations centers, let's make sure that we're linking and that we're communicating information among all of those emergency operations centers if they need to be activated. But perhaps most importantly, what should citizens do right now? And I realize this is not a real sexy list, but it's common sense stuff that works. Stay focused. Seriously, stay focused on what's important in your life, your family, your job, your faith. Stay informed, but don't be overwhelmed by the media or social media. And so when we say stay informed, that means visit a reputable site for information. The City of Dayton site, Public Health Dayton and Montgomery County, the Ohio Department of Health, the CDC. All of the up-to-date information is going to be on those sites. Take everyday actions to stay healthy. We covered a lot of those in the previous slides. Cover your cough. Wash your hands. Don't touch your face. Avoid sick individuals. If possible, avoid mass gatherings right now based on what's being indicated nationally. And let's never lose sight of the fact that seasonal flu is still with us. And it's important for individuals who are not medically contraindicated to get a flu shot because it's still protective against seasonal flu. And then from a planning standpoint, again, a family emergency plan, and And it's the same information that we share all year long regarding emergency preparedness. So we should all be keeping an adequate supply of food, water, medications, and prescriptions if needed. Make plans for your children in the event that schools and child care centers ultimately need to close or alter operations. And then, obviously, based on everything that's rapidly evolving, take a look at all of your travel plans, and if it's not critical or mission essential, or if it's not essential travel, consider changing those travel plans. So there's a lot of communication out there. We're updating the information on a daily basis. Please visit our website, and then we'll also make sure that we continue to link to the City of Dayton website. There's just an image of our website, and then there are other resources that we referenced: the Ohio Department of Health, the Centers for Disease Control and Prevention, and the World Health Organization. Perhaps most important, though, as we as a community become more and more united, and as we focus on equity and making sure that every individual has equal opportunity to be healthy, we cannot continue with any type of stigma associated with this virus. And it's really about, I ultimately believe that as a society, we will, long-term, way in the future, we will be judged by how well we helped those less fortunate than us. Be kind, be compassionate, help others. We're all in this together. And that's a quick presentation from Public Health Dayton and Montgomery County, and we would be happy to answer any questions that you may have.
Jeff, thank you. Thank you, Doctor, for your work on this. I'm sure we have lots of questions, and so I'm going to open it up to the commissioners. Commissioner Fairchild?
Well, we have a big event coming up where people are going to gather with the first four.
Correct.
Do you have any guidance on that event?
So I think we're all aware of what the governor said yesterday regarding indoor sporting events and that they should be spectator-free. Please know that we are communicating with the City of Cleveland because there are games in Cleveland, I think March 20th, 21st, something like that. The Ohio Department of Health, and I believe there are, well, I shouldn't say I believe, we're communicating with the NCAA as well, and I believe there will be a final recommendation, very likely by the end of today, in terms of what's going to be recommended by the NCAA. Yep.
Any other questions for Jeff? Commissioner Mitt?
No, very thorough.
First of all, thank you. Second of all, and this is a question probably just as much aimed at our staff too, but there are at the city a lot of public-facing employees. Do you have specific recommendations? Are there activities underway region-wide, or are those things that the cities themselves need to take care of to protect them?
So, give me a little bit more information on.
We have employees who basically sit at a desk or they're in City Hall.
Okay.
There are also employees who are public-facing, whether they're water employees or
Okay.
folks that are out in the community,
Yeah.
or public safety forces. I was wondering if there is a standard way to protect them, or like a region-wide focus on getting protective equipment, that sort of thing, or is that something cities need to take care of?
So for individuals that are within an office environment, and we're looking at this as well, we're looking at our continuity of operations plan, and are there options for our employees, if possible, to telecommute or work from home? A lot of that's going to be a function of making sure that they remain educated on covering their cough, washing their hands, wiping down environmental surfaces, etc. We're very likely, like most entities, going to be moving to more teleconferencing as opposed to bringing groups together for internal meetings and things like that. As far as public-facing employees, obviously we still have mission-critical jobs that need to be done. One of the issues is that we're all looking for the definitive answer, and right now it doesn't exist because a lot of the information is still early on. However, I think we need to continue to revisit the fact that the risk to most individuals in this country remains low. Certainly, public safety forces that are interacting with individuals who may be ill, personal protective equipment is probably pretty important. Yeah. You want to offer
Ms.
any
16, do you
comment?
have something you want to add, like on what the city staff's getting ready to do on this effort?
Of course. We, in our emergency operation plans, have such measures in place for our public-facing employees. I was going to make some comments at the end of the meeting, commissioners, as to updating you all in the community on what the organization is doing in response to a potential elevated COVID-19 situation.
Thank you.
Great.
I was just going to add that within emergency medical services and others, there's a realization that the 6-foot sort of barrier, if you will, I mean, that's not as though it's a firm line all around people. For instance, 6 foot behind me is different than 6 foot in front of me.
Right.
Okay, that we know that just a plain surgical mask, it can be very effective at stopping those respiratory secretions. So to some extent, if you got somebody who's coughing and sick, you toss them a mask, you know, essentially, you have them put it on. The droplets settle out at about a meter, a little over 3 feet in most cases. So the 6 foot is a little bit extra in that way. And so I think that there is, you know, there are the recommendations, and there's also looking at the situation and having the professionals involved evaluate what's going on and being able to either maintain a 6-foot distance, or if they need to engage with the person, having the proper equipment to do that, and knowing that there's that area in between where you can get a mask on the person, you're probably in good shape. One of the concerns was somebody shows up at a doctor's office. You know, what about all those people in the waiting room, people in the hallway when they take them back or something? CDC has said that just passing by somebody who's got an active infection is very unlikely to account and spread, so that it takes some amount of dwell time, if you will. And so I think all of these factors are things that emergency medicine, medical services, as well as law enforcement are sort of aware of and making plans about.
Thank you, Doug.
That's good.
Any other questions?
I'm done. Thank you.
So just for the public here, we talked a lot about the way to prevent this is very similar to the flu. You know, the same thing that we talk about every season. How is this different than the flu? Why is this becoming, you know, such a bigger deal than the flu? Why?
Because it's new.
Yeah.
Okay.
Which means that, I mean, if you think about the flu, I mean, the flu season lasts for months and months and months. Starts in Asia, gets here months later, okay? This is a new virus. It's an entirely new exposure for humans, and it is spreading rapidly because our immune system has never seen it before, that it is very virulent, which is the case. These things tend to get less transmissible and virulent over time, and by time we're usually talking years, okay? And so this is a classic introduction of an infectious disease to a totally naive population, and because of the way that we move around the world, it can spread very rapidly. The faster we get on this, the less likely we get some huge spike like they had in China, the more likely we have time and ability to sort of plan out, the more likely we have the resources, because instead of having to use them all right now, we've got time to recoup resources, replace things, and we get a sort of a smoother curve. So that the kind of measures that the Ohio Department of Health and the governor are talking about may seem drastic, but the payoff is going to be in the next few months when we don't have some huge spike. I mean, consider Italy. They went from what, 9 cases to 9,000 within, what, a week, 10 days, something like that. So that is certainly going to overtax things and cause confusion. So that this is a way to sort of manage what is here and what's going to be going on in a way that that we can apply the resources in a proper way to deal with it.
Mayor, if I could amplify that, that's a very good point. I want to make sure that especially the viewing public realize what that is. So the point of these measures that are happening, preventing close contact with people, everything you've just mentioned, is not necessarily going to stop the disease. What it will stop is a huge spike of everybody getting sick at the exact same time and overtaxing all of our resources, which would probably cause more fatalities. It'll spread things over time and hopefully mean that less people die. And hopefully less people get sick, but mostly less people die, so that we don't overtax the resources. It makes the curve go, instead of like this of cases, it'll spread it out
Over a longer period.
over a longer period.
So really, our success in this is to raise awareness hopefully everybody pays attention, and then everybody feels like, well, that wasn't a very big deal at the end of it, because everybody's done what they're supposed to do.
That's right.
Correct?
That's what we would like.
That's what we would like to see.
Yeah.
Okay. The last question, this is, I know we can't really predict, but in your sense, you know, when you talk about limiting travel, you know, closing schools, I know a lot of that discussion has been till April. But how long are we talking about here? You know, the flu season, for example, is, you know, a few months. So what is the, I mean, I'm not going to hold you to this because I know it's ever changing and dynamic, but like, what are we talking about?
Go ahead. and then I'll go.
I mean, right now we have an epidemic. The other word to know is endemic, so that there are diseases that are endemic, which means that they're just existing and they just keep kind of going. The expectation would probably be that unlike the other SARS, which is no longer, SARS-1 is no longer a threat to humans. I mean, it's essentially been eliminated. The expectation for this one, because of the way that it's spreading and the way that it's behaving, is that it's likely to become an endemic disease. That's why they're very, you know, working on a vaccine, which is going to take a year and a half. But the expectation is this is a long-term sort of thing. The measures don't have to last that whole time, but we may be, NIH, Anthony Fauci is talking about 12 to 14 months of sort of an acute phase. Not that all of these restrictions would be in place that long, but that's the time that they expect that it's going to take for that sort of longer curve to maybe get down to some baseline level.
So a while.
A while.
Yeah.
All right. Well, I really appreciate, and I don't know if everybody good, I appreciate you coming in this morning, appreciate your leadership. I know between myself or my staff, we talk every single day, and appreciate your willingness to stay in touch with us as we make sure that we're giving the most up-to-date and best information for the community, and thank you.
Thank you.
both.
Thanks for the opportunity.
Yeah, thanks again.